Hello everyone and welcome to Pills in a Pod, a podcast where we meet healthcare leaders, change makers and game changers. Today we have none other than Dr. Huzaifa Khorakiwala, Executive Director Wockhardt, CEO Wockhardt Foundation, founder of the World Peacekeepers Movement and Chairman of the Global Justice, Love and Peace Summit. Welcome Dr. Khorakiwala to the show. Dr. Khorakiwala, I'd like to start straight off asking you, I did some rough calculation. Wockhardt was started in 1967. You may have been very young that time when this
I was born in 70. I was born after 3 years.
Okay. So what was your childhood like and what were the people who influenced you and what was school life like? What was college
So when
life
I was young, I had a very powerful influence of my grandfather. There was a Akbar Ali's department store and he was quite a prominent citizen of Mumbai, and he finally became Sheriff of Mumbai in 1992 when there were riots in Mumbai, and he formed the largest human chain in the world which was around 10 kilometers. It was a chain of peace and harmony. So he had a very strong social network and he was well networked in the different communities in the society and all. And out of the shadows of my grandfather, my father started a pharmaceutical business. He was successful right from the beginning, and step by step he grew the company Wockhardt. So initially the manufacturing was at Worli in Mumbai, and then they shifted the manufacturing, Wockhardt shifted to Aurangabad because it was a backward area and the government had identified it for tax incentives. So the main factory of Wockhardt was in Aurangabad. Then that way the company kept growing. It diversified into biotechnology. So we had insulin products. Then it diversified into international markets. And today 50% of our sales of the company come from United Kingdom. Also, I would like to touch upon a bit later on the antibiotic drug discovery, how Wockhardt started.
Absolutely.
And what it holds the future for the human race.
Yes.
So I'd like to talk about
Of course. And I've also heard, and tell me how true this is, Wockhardt, the word came from Worli Chemical and Works. Is that true, or was it the German word work hard and that's why Wockhardt?
Yeah. So actually the word Wockhardt comes from Worli and chemicals. So that comes Wock, number one. Also we have to make it sound work hard. So that everybody who's associated with Wockhardt, they work hard. And then thirdly, during that time, there was a scientist in our company whose name was Earnhardt.
Oh, okay.
So we took the heart from him. The Wock we took from Worli Chemicals. And the heart we took from the scientist.
Very interesting story. But your family comes from a deep-rooted business family, and you chose CSR over this. Your core is CSR over this whole thing. Why suddenly did you choose CSR versus pharma when all this was happening?
I finished my MBA from Yale University in '96, and then I was part of the business for 12 years. I was part of veterinary animal health business. Then I was part of the international business and all this. Then I told my father that when CSR was becoming mandated by the law, I told my father that more than 10,000 employees are trying to look at the economic growth of the company. And I think someone from the family, if he looks at the social aspect, where there's social service involved and all that. So that is why I volunteered it to him and he accepted it. But it was his kindness that he kept me on the board of directors of the parent company. So I still have a little bit of management and I'm still part of the parent company. But my main work during those times was with the Wockhardt Foundation, which was established in 2008. And it has been now around 16 years it has been established.
And was there a defining moment or was there a defining experience that you had that made you feel that social impact was your real calling?
It was a mix of different things. I was always reading a lot of philosophical books. So when you read these books on philosophy and spirituality, you realize that the life in the world is very short. So you want to do something not for a purpose of applause or something, but for the reason of the cause. Not for applause, but for reason of the cause. So we want to do something which has a permanent benefit. And the permanent benefit that remains after our body dies in the mud is the soul. So the soul remains for a longer time. In fact, it is eternal, the soul. So it carries the imprint of our deeds, the words that we speak, the deeds that we do. So that is why it's important that we invest our time, short time in this world to maximize the good deeds, so that I believe there is a hereafter, and in the next life we reap the rewards of the good deeds that we have done in this world.
It's a very interesting take. Very few pharmaceutical leaders who think in this direction. I mean, you could either choose a thriving business, but you chose this as your call. I mean, it must have taken a lot out of you to make this call.
No, every person in the world has a different mindset, you know. There are some people born with a practical mindset to solve the worldly problems. There are some people born with a creative mindset. And there are some people born with a spiritual mindset. So there is a certain natural attitude, or rather an inclination, where people are attracted to pursue that type of thing.
I understand.
And I had a natural aptitude that I was attracted to pursue a more spiritual type of thing.
So was there a moment, was there like a eureka moment that happened in you that felt that, you know, I just want to do this, or did it just gradually grow on you?
There was not a eureka moment. It was growing over the years, and it was always ingrained into me. Then I never liked loud parties and all this. I never had drinks in my life. I never had smoking, all this. So I didn't have the normal young people, what they like to do. I didn't find myself mentally attuned to that.
Sure.
Obviously, when you don't spend time in some other thing, then you need some other thing to fall back on.
Yeah.
And that thing was the spiritual pursuits which I had, which I fell back on.
Super. So, Dr. Huzaifa, you've impacted millions of lives with Wockhardt Foundation. Is there a story that you could share with our viewers which deeply moved you and reaffirmed your mission? A particular child's life, or a particular woman's life, or a man's life that you really changed, and it really reaffirmed your, that mission that I'm on the right path.
So these stories, actually on my WhatsApp message, every day I have around 2 to 3 people requiring jobs. Then I have 2 to 3 requests for money for health reasons. Somebody is in a very bad situation or something. And then we have a Wockhardt hospital in Bombay Central and Meera Road and all this. There are another 2 to 3 requests every day for helping people in the hospital, etc. So this is a part of the daily life. So the thing is, when all these requests are coming to you, there are 2 ways of reacting. Either you try and help in the request, or you ignore the request. So every time a request comes, it is a test from the Almighty, how I'm going to react to it. Whether I'm going to be giving, or whether I'm going to be selfish. And when I press the button of selfishness, then I fall in the scale of human values, and I will lose some part of the peace of mind. That's why actually what happened was, in 2013, we formed a movement, the World Peacekeeper Movement.
Yeah.
And that movement was based on 7 human values. That is gratitude, forgiveness, love, humility, giving, patience and truth. So every value was for 1 day of the week.
Oh, wow.
Yeah.
Okay.
So, and every value had an opposite to it. So the opposite of gratitude was complaint, forgiveness, revenge, love, hatred, humility, pride, giving, selfishness, patience, panic, and truth was falsehood. So every time you press the positive human value by the law of karma, you get more inner peace. And every time you press a negative human value, by the law of karma, you lose the peace. So we are every time pressed with this, and there are 1.8 million peacekeepers of this movement, and they are going to be part of the global summit also.
Yes, we'll get to that very soon. And
Yeah.
I just want to add, Dr. Khorakiwala, that we started this thing in our office called the gratitude bell. That every time somebody achieved something or somebody helped somebody in some way, we just go and ring the bell and we congratulate the person, or we thank the person, or we recognize the person and things like that. And we've seen that from the time we've started this thing, it's been so much more easier. Life has been much more easier. The happiness quotient at the office is so much nicer. And I so agree with you on at least, on obviously all 7, but the gratitude one that you started with is something that I really, really resonate with. But it's obviously not going to be, it must have not been an easy journey for you, I'm sure. So what are the challenges you're faced with when running these large social initiatives, and how have you navigated through them?
If the intention is there and the intention is in the particular direction, then you just have to form the how to achieve the objective.
Yeah.
So the first thing starts with the intention.
Absolutely.
So whatever the intention is, you have to make it very strong, and you have to be committed to the task that you have to achieve. So once you are committed, then there is, I think, all the problems in the world, they have a solution. So in the same way, when you take a social initiative, there will be many obstacles on the way. Let us say in the social initiative, on the target is to reach, there's a ladder and there are 10 steps in the ladder. And the target is to reach the 10th step of the ladder.
Yeah.
But we have to climb it one step at a time.
Yeah.
And that every one step you take, you put the right strategy behind it, then you work hard for it to achieve it, and you keep climbing one step, then you achieve the 10 steps.
So we stay true to Wockhardt even coming in the social initiative part of it. Very interesting.
Yeah.
And let's come to pharma now. So how do you see the industry evolving? There's so much happening over here. How do you see that evolving, and what role should it play in improving healthcare accessibility?
Pharma industry has many responsibilities. One is to find a cure for uncurable disease. For example, cancer is one of them, HIV is one of them, etc. There are many diseases in the world where there are no cures. So the role of pharma industry is to do research and innovation. And there is a cure for nearly every disease. But the question is the right research and the right innovation required, and the dedication to do that research over a number of years. Then the second part of pharma is that the medicines that they produce, it should be affordable, number one. Then it should be available and accessible to the bottom of the pyramid. Because we generally find that the healthcare reaches the urban areas, but the rural areas where, especially in India, 60 to 70% population is there, the access to healthcare is not there. So the availability, accessibility, both are required. Also, the third part of pharma industry is that they should not misrepresent the claims of their product. Whatever the claims of the product are, according to the scientific knowledge and information, they should stick to that claims only. And so transparency, honesty is very important. And the service should be an equal objective of the pharma industry as well as profits.
This is easier said than done, right? I mean, it's such a competitive world, the pharma industry.
Yeah.
So how do you find that balance between, putting out the right information and trying to get the next big sale? I mean, that's a tough one, right?
See, it's like a boomerang. When you throw something and on that boomerang your name is written, but the boomerang will come back to you.
I love that.
Yeah, because your name is written on that.
Yeah, you're right.
So
absolutely.
If you write truth on that, then your name with the truth will come back. So finally, over a long run, the values always sustain.
That's a beautiful thought. Thank you for leaving us with that. Yeah. Let's come to some exciting stuff, right? Okay, so what's your opinion on marketing and these new brands that are coming out. I mean, Wockhardt has recently been in the news for Zaynich, and you're in the news for McNabb and things like that. So tell us about that. I'm sure you're very excited.
So this was started around 25 years back by the Wockhardt Research and Development team with the vision of our chairman, Dr. Huzaifa Khorakiwala, under the Chief Scientific Officer, Dr. Mahesh Patel. And he had a team of dedicated scientists, about 250 to 300 of them. And they were based in Aurangabad. Our chairman had decided that while the multinational companies were exiting the antibiotic space, he wanted to enter the same space which the multinational companies were exiting. Because at that time, some research was showing that there will be AMR, which will be a biggest problem in the world.
True.
And antimicrobial resistance indeed has become today killing 5 million lives every year. So this is a major thing, and without medicines, the latest medicines, AMR will continue as a bigger threat, and it will take a lot of these lives will be lost in AMR. AMR is antimicrobial resistance.
Yes.
So the microbes that develop resistance to the antibiotic, the reason is because as antibiotic works for 5 years, 7 years, the microbes become intelligent and it's survival of the fittest, they evolve, and then the antibiotic stops working with those microbes. So we require a new type of antibiotic, and Wockhardt is the world's leader in antibiotic research, and it has come out with 6 antibiotic products which are patented, and all the 6 have a QIDP status with the US FDA. And the biggest of them, Zaynich, which has a very wide coverage over every single pathogen, gram negative and gram positive. It got the clinical trial results just announced, and it was 97%. So this is a beacon of hope for the entire humanity.
Yes.
That where in the ICU, where none of the antibiotics are working, Zaynich will be saving millions of lives of the entire humanity.
Yeah, that's a fantastic. I mean, I'm sure the whole industry is excited about this, and I think they should be for the kind of work that you're doing. And tell me a little about McNabb.
McNabb is another product, and it is for pneumonia. So McNabb has a very good penetration and efficacy against pneumonia. So also about Zaynich, I would like to tell one thing, that Zaynich has a factor of 64. So it is a penetration factor of 64, while the other antibiotics have only reached 8 and 12.
Oh wow, okay.
So that is how much superior Zaynich is compared to any other antibiotic.
Yeah. And these are, correct me if I'm wrong, but this is what happens in hospital-acquired infections, ventilator reasons of infections. And
Yes.
So that's a big cause of death these days, right? I mean, it's exciting to see where you're going. But having said that, while you will be launching these big blockbuster brands, and when they do come across, how will you address the urban-rural divide of India? I mean, it will always be a problem. I mean, these medicines will be accessible to probably the urban areas, and how will we address those gaps?
Right now, we have just got a clinical trial.
Yeah.
Another 9 months will take US FDA to give approval, and then we will launch Zaynich after 1 year. Regarding the urban-rural divide, I believe our management is thinking of a certain way in which there should be more accessibility towards even the people who cannot afford it.
Yeah.
So that there is a saving of lives, etc.
Sure.
Yeah.
Sure. Interesting. The entire pharma industry, entire healthcare industry is now still grappling with digital, AI, telemedicine, and all these new terms. What is your view on this? How do you see it transforming the industry?
I think AI has already made a deep inroad into the healthcare industry. There are a lot of things which AI can do very well, and there are some concerns about AI leading to loss of jobs, etc. I think digital health, AI, these are positive aspects. May come out negative out of them. there should be some way of addressing that.
Yeah, I think this loss of jobs and something taking over has always been a concern, right? Like when I was very young, I remember my mom was a typist. She was just a typist. You know? She'd work at a law firm and she was a typist. And she came home one day and she said, I think I'm going to lose my job. So like, why do you think you're going to lose your job, you know? My dad was a medical rep. So 2 people earning in the family. And she said, because now they're going to take away the typewriter and now they're going to introduce a computer. But I think the human life or our perseverance is such that we learn to thrive in such kind of change.
Right.
And I'm sure this will happen with AI, with digital and with things like that. What is your opinion on that?
Because I think even if the AI, the jobs are lost, I'm sure it will lead to higher incomes.
Yeah.
And then the question will rise, how do we redistribute the income?
Yeah.
As long as there is a social mechanism where the AI increases the profitability of corporates, and that profitability is taxed and the redistribution goes to the poor people. So there can be a mechanism of addressing this,
Yes. Yeah. Fantastic.
Like the machines were there and the industrial revolution took place and all the automated machinery.
Yes.
And then we may think that there'll be loss of manual jobs.
Yeah.
So industrial revolution came. We got lovely products, everything lovely we got. But even though the jobs were lost, the humankind continued further.
Yeah.
So that
and became stronger, I'm sure.
Yes.
Let's come to the part where you're most excited about, which is your new summit which you have announced, which is the Global Justice, Love and Peace Summit, which is going to be happening in Dubai on April 13th, 2025. And you invited half the world over there. Tell me a little about that.
So the Global Justice, Love and Peace Summit, further extension of the online movement we had on the Facebook, which had 1.8 million peacekeepers. We have just renamed it. Now we call it I Am Peacekeeper Movement.
Okay.
And the summit has 72 speakers confirmed. We have stopped the speaker count because it's a 2-day summit on April 12th and April 13th. And there are 12 Nobel Peace Laureates. There are 12 religious leaders, including Sri Ravi Shankar, Baba Ramdev, etc.
Wow.
We are from all the religions of the world because we want to create interfaith dialogue. And also, the Nobel Peace winners are going to sign a peace charter, which will be released on the last day of the event.
Okay.
And there are going to be 28 awards also. 28 PAX awards. PAX is the word for peace in Latin language.
Okay.
Excellency Sheikh Nayan bin Mubarak Al Nayan, the Minister of Tolerance and Coexistence of United Arab Emirates, is the chief guest of the event.
Wow.
And we are hoping other royalty will also come, which we will announce when it happens. And they are targeted to be 2,800 delegates. So it's going to be the largest private summit on justice, love and peace. They can network amongst themselves. So we are going to have 28 networking tables, which can be booked in advance. The number of the summit is 28. So there will be 28 dishes on the menu for all the meals. Then every speaker has agreed in the contract that he will shake hands with 28 lucky draw winners. And there will be a caricature of the speakers and all. And then there will be a culture hall where there will be some poems and art and everything on the topic of justice, love and peace.
I love it, and I like this 28. I'm a big believer of numerology, so I know that 28 comes to the number 1, and 1 actually always means leadership and power, and
2 is the number of moon.
Yes, 2 is the number of moon.
And when you put the hard work of 8 of Saturn, then 28 has many significances. So in the brochure of our summit, there are 12 significance of 28. So one is there are 28 mansions of the moon, like Vedic astrology believes. There are 28 nakshatra of the, like that. There are many significance of the number 28.
And I had once seen a movie called Hachi. I don't know if you've seen that. In that, Hachi is actually the number 8. And 8 means infinity. And in Japanese, they say that it's like starting from heaven, coming to earth, and then going back to heaven. That's a beautiful analogy again of the number 8. It's an interesting thing.
Yes.
I was going to ask you my last question, Dr. Khorakiwala. Give me 5 life lessons I can get from your life. but I think I'll probably take it to 7.
Yeah, I think, how did you know 7 is my lucky number?
I did my research.
Yeah, okay, great. So you have done good research on me. So I have to, so the 7 is the following. I have not prepared which 7 to say, but I'll just say it.
Yeah.
The first is work hard. Work hard is number 1. Number 2 is be grateful.
True.
Number 3 is forgive easily and fast. Number 4 is be humble. Then number 5 is spread love. Number 6 is be patient in times of hardship. And number 7 is do your best and leave to God the rest. So these are the 7.
Thank you. That's a goosebump moment for me.
Yeah.
I'm going to take that 8 and
So
I'm sure it's going to
7,
go.
7.
Yeah, 7. Sorry, I'm going to take those.
I hope you can write down the 7.
Yes.
When in my interview you are writing it.
We will.
Yes, yes.
Yeah, and we'll make sure that we'll try and spread that word out as much as we can.
Okay.
Dr. Khorakiwala, it's been a pleasure.
Yeah.
Thank you so much for your time. Thank you so much for your inspiration, your ideas, your insights, and your lovely, lovely thoughts.
Okay. Aleem, it was lovely that you took interview and you are deciding to put this in the pills in a pod.
Yeah.
And I would like to wish you all the best.
Thank you so much, sir.
And may you carry on your work with the same lively energy that you have.
Thank you.
And the positivity that you have. And I pray for your peace and for your success.
Thank you.
And wish you all the best.
Thank you. Thank you.